So, hello to those still in the room, those online. We should expect there are more, and those who are following us, watching it back perhaps over the coming weeks. So, our next speaker is Dr. Lynsey McColl. I don't have her bio with me, but I can tell you that she's been really critical to the work we've done just recently on developing benchmarking for age assurance and helping us to understand how you can apply complex stats in a way that is hopefully simple enough for those of us who are practitioners to be able to apply those in our work. So I'm sure she'll share more on that. So welcome, Lynsey. Thanks.
Thank you very much, Ian. I realise that this is probably quite a more technical topic, and a lot of the people here today are talking about quite more sort of the impacts, but I appreciate everyone for coming today and everyone online. And I promise that there are no equations in my slides. I'm going to keep it fairly light. So first of all, I wanted to talk a little bit more about who I was, just to give you some context. So I'm a statistician. And I have worked in the age assurance and do work in the age assurance sphere, but that's not what I do entirely. So I run a statistical consultancy company, and you can see from the slides, our clients are really quite varied. So we have clients in the public sector, we have clients in charitable, not-for-profit, we have clients in the private sector. So it's a real mixed bag of people that we work with. And I thought I'd just give you a few insights into the sorts of projects that we work on. So, for example, we have a reasonably large retailer, a global retailer that we've been working with for around 5 years, and we work directly with their, like in partnership with the brand team, and we do customer segmentation with them. So they have an annual survey which they have, and they collect lots of data about purchasing behavior, about lifestyle attitudes, about attitudes to different brands, demographic information, and we take that large amount of information and we have sort of dimension reduction techniques, and we put it into a clustering algorithm that essentially segments groups of similar customers, and it really gives that company a really good insight into who their customers are. So you might have a segment of customers who are interested in trends, so fashionable trends, how things are moving. They might be mostly interested in collaborations. They'll be typically younger customers. And then you might have another segment of people who are interested in quality, craftsmanship, ethics, buying one piece that will last them a long time, and their demographics will look different. And basically you can see a better understanding of who your customers are, but in a really quite simple way, what the market share of those customers are. And then because you do that over time, you can track how that changes. So that's a really nice sort of piece of work that we do. We do lots of work in customer retention. So for example, if you're a subscription service or you have like a gym group, there's a type of model in the healthcare sector that's used a lot called a survival model that predicts the probability of a patient surviving. But we can use that in lots of different spheres. So for example, if you were like that gym group example, I could say, what's the probability that a customer is going to lapse their subscription based on the way they're behaving recently? And if that's like a high probability, you could sort of target those customers with incentives. We do key driver analyses, which is this idea of understanding what the key drivers are to particular things. So we did a nice piece of work with the film and TV industry charity, and they were interested in, so it's quite an important sector for this charity to work in, because a lot of the people that work in this industry are self-employed. They don't have companies, they don't have HR departments looking out after them, and they were interested in mental health. So again, they did a large survey, and they were interested in understanding what are the things that really drive mental health in this industry, so that they could then go and like focus on what those things were to try and drive improvements. And so, for example, they found like financial security was really one thing that was really important to people, but also different types of industries, like, which ones were the worst in terms of mental health. We do EDI analysis, which is really interesting. So quantitative analysis of diversity data to understand how diversity is in different organizations. And we work with a really great EDI consultancy who then benchmark that and provide recommendations. And then finally, we do a lot in healthcare studies. So looking, like, for example, with medtech companies who are designing novel devices, like proving the efficacy of those devices so that they can go into production. And I think that healthcare studies is the one where I feel like there's most synergy with this particular sphere, because, you know, there's a lot of areas where, you know, you might have new diagnostic tools and you want to assess accuracy. So I can see there's real synergies. So that's a quick kind of tour of like the other things that we do in our company. And so I just thought it might be interesting so that you can see the sort of breadth where you can use statistics, but also the fact that there are these like synergies across different sectors that we can learn from. So in terms of age assurance, so I've been working with Tony, who put together this conference for a number of years. First of all, working with Age Check on their technical requirements. And then secondly, we worked together on some research that the ICO and Ofcom commissioned into measurement of the efficacy of age assurance systems. And Tony and I spoke about that in more detail on Wednesday. Okay, so a bit more about stats and how we can help in terms of the age assurance technologies. So I wanted to talk a little bit about how stats can be used. So how can we use stats to help? So, and I have to say that this is very much looking at it from the perspective of looking at the performance. So you've got your AI model, you've got your machine learning, your neural network model, you've produced your technology, and then you want to deploy it. So I'm sort of thinking about this more in terms of like, how do we assess the performance of that model? How can we be sure and happy that it's fit for purpose in terms of deployment? So how can we use stats to robustly test the performance and accuracy of a technology? And so I think it's really critical and important that we understand what the objective of the test is. You know, so if you don't design your test properly as a statistician, then you can't be necessarily certain and happy with the conclusions that you're going to bring. Like, are those performance metrics that you use meaningful if you don't design your test? You know, as a statistician, quite often, you know, people will come to me after they've designed a study, after they've collected the data, and there's lots that we can do with that data, but quite often I wish they come to me at the beginning so that we've talked about how they were going to go about collecting that data and what the objective of the data collection was, just so that we could improve that design. So I think what's really important in this world is that the test should be designed to ensure that it appropriately reflects its deployment, because otherwise these accuracy measures that we might produce won't really mean anything. So a nice example is, you know, in the UK, we use Challenge 25. The idea being that if you go into a shop, for example, and you want to buy alcohol, if you are identified as somebody who's being over age 25, then you can carry on and you can buy that alcohol. But if you look under 25, then you're going to be asked to prove your identity. And that's something that I know that like a facial age estimation technology is being deployed in retailers to do that. And so if that's how you're going to deploy it, then that's how you need to design your test. So how accurate is your technology at Challenge 25? And of course, but that could change. It could be, how accurate is it at Challenge 21, or how accurate is your technology at identifying whether somebody is between 13 and 18, you know, to join a safe space for teenagers. I think in terms of this idea of design, again, I feel like when I work in the healthcare sector, you know, we are quite often brought in to help because there's like clinical trial protocols, and this is a really standard thing that, you know, whenever somebody is going in, you know, putting together a trial, they have to put together a protocol, and in that protocol, there's going to be the objectives, what the study is, they have to put what the selection and exclusion of subjects is going to be, there's everything about ethics in there, how they're going to handle the data safely and store it, you know, quality control, and then and also the analysis plan, what are the statistics that you're going to apply, and that's all put down upfront in a protocol that is kind of, you know, set and locked down before you then carry on with the study. And it feels like, you know, there's sort of maybe some learning there from the age assurance regulatory or certification thing that we could learn from. So when we're testing, who are we testing? So how many test subjects do we need? So, sample size calculations are something that we do really regularly. So if you are going to test something, how do you know how many samples you need in order to be really confident in the results that you have? So, if I have 50 subjects and I say how accurate is my test compared to if I have 1,000 subjects and I know that the precision, the margin of error associated with the estimate from the test with 1,000 subjects is going to give me much more confidence in the results. So we know that we need to have enough people to be testing with. Of course, the test data set needs to be independent from the training data set. It needs to be, and I think that when we had workshops with the ICO and the Ofcom last year, and we had a lot of stakeholder engagement, there was a huge amount of discussion about test data sets. And I've got a slide on that next because there's a lot of practical issues with that. What age range should the test data set be made up of? And of course, ideally you want your test data set to be representative of your population that you're looking in. So you want to be thinking about, is it representative in terms of gender? Is it representative in terms of ethnicity? There was a really hugely interesting talk from NIST on Wednesday, which I would really recommend going back to watch if you didn't, from Patrick at NIST. And he's got this huge data set that, I don't think anybody else in the world, well, he doesn't personally, NIST holds this huge data set, and they have done a lot of testing in this data set. But obviously his data set is imbalanced, so there might be more men than females, or there could be an imbalance in terms of ethnicity. So what he's done is this really interesting, he's looked at all the different combinations of ages and ethnicities, and he's come up with some interesting ways that you might be able to weight those accuracy measures to take into account the imbalances to have one final measure. So, that's the kind of idea of the using stats to really think about how best can we take the data that we have and use it meaningfully. So again, like I said, I just wanted to point out the sorts of things that with the discussions that we were having at these workshops last year with stakeholders, because this test data set question, I'm sure there's probably been a lot of conversation about it this week. There's so many challenges with gathering, curating, and maintaining test data sets. They've got to be independent from those that are training the model, and also they contain under 18s. They need to contain children in it. And so, there's all sorts of issues like the ethics and lawfulness, and obviously that idea of lawfulness changes depending on where you live. There are different data protection enforcements in different areas. And obviously, I've sort of been talking about age estimation in terms of facial, but we also know there's voice estimation. There's somebody talking about ECGs this week. There's hands. There's, it's not just we need images. We need, all sorts of types of data. We don't want perfect images. We want that data to be reflective of real life. So yeah, I acknowledge, but I don't necessarily have solutions, that there is a lot of challenges associated with building up this test data set. So we can use statistics to, so what are we measuring when we're testing age assurance technologies? So in the ICO and Ofcom research that we did initially, we sort of put this distinction between age estimation, where you were estimating an age, which is like a continuous outcome, and age verification, which is like a binary. You've got an eligibility criteria. Are you over or under 18? Are you over or under 21? And that's like a binary outcome. And so we sort of looked at the idea that there were different types of performance measures. So like for, continuous outcomes, you could be looking at mean absolute errors. You can look at mean errors. You can look at median errors. You can look at, different, statistics for the variability of those distributions. And then you've got, with your binary outcomes, you've got different types of metrics entirely, which are all sort of based around this idea of a confusion matrix, which I talked in more detail on Wednesday. I think definitely the consensus when we were doing the workshops with stakeholders is that ultimately when you're deploying your technology, whether you have an age, even if you have an age estimate, you're ultimately going to deploy it in a binary way. And so actually in reality, these metrics that look at binary outcomes are the ones that are probably going to be of primary interest. There's been a lot of discussion, I think, this week on the appetite of a sort of overall primary kind of headline metric and what that might look like. But I think there's also an acknowledgement, and this is it's the same in the research that we did, is that there isn't one metric that necessarily fits all. You know, each of these metrics tell you something different about their performance, and really we probably need a suite of metrics to look at. You know, and so again, it really depends on the deployment and how we're using these technologies. But I think, you know, we probably need options of different metrics, and we need to report multiple metrics. And then finally, I just wanted to touch a little bit more on, so obviously I'm talking about performance metrics quite generally, but we also really need to be aware that age assurance technologies can result in bias and discrimination. And actually, it's not just, you know, all sort of machine learning and AI models can result in bias and discrimination. And that is often unintentionally or unknowingly. And there's lots of different ways that biases can be, you know, can occur. It can be behavioral bias. It can be about, you know, quite often it's very much about the data that you put into your models, especially in this area. You know, getting training data sets is difficult. You know, maybe your training data sets have more males in them than females. Maybe they have different ethnicities. The breakdown is not there. You can have corrective biases where you go in and correct something and it causes a bias in something else. So there's lots of ways that biases occur, and we obviously need to look into that when we're looking at performance accuracies. So the Alan Turing Institute have a really nice kind of framework and set of guidelines about biases. They talk about 4 forms of fairness. So data fairness, this idea that your data needs to be representative, design fairness, outcome fairness, implementation fairness. And I think for us, like, we have been focusing on, in terms of identifying whether biases exist, on outcome fairness as a way to measurably or quantify how, you know, how fair and equitable your technology is. So the idea is that if we produce performance metrics, we also want to break those down by gender, by ethnicity, for example, to make sure that these things are not, there are no very large differences between like protected characteristics. And again, I would recommend Patrick's talk on from NIST on Wednesday. He goes into this in quite a lot more detail, where he has done a lot of breakdowns. He also talked about the difficulties of the ethnicity question, because typically people have been using like skin tones and Fitzpatrick scales to have a look at biases in ethnicity, but he's pointed out the various difficulties with that, and he's been using country of origin as proxies for ethnicity. So there was a lot of useful information there in that talk. So there we go. So that's a quick roundup of how I think statistics can potentially help with the assessing the performance in terms of how, who, and what. Statistics is often used in an important part of setting up test protocols. There are a lot of, it's one piece of the puzzle. There are a lot of other practical considerations, and I think partnerships work. You know, in my area, I typically work as part of a team of other subject matter experts, and I feel like that has been, you know, this is what has come out of this week. It's been such a great week for lots of subject matter experts to get in the room and talk together, and that's the way that we solve these problems. And I think, you know, there are definitely synergies with other sectors such as medical and healthcare that we could potentially learn from. So thank you very much.
Questions? Mark, we do have 12 people online, I've noticed.
Good job.
I have a couple of questions. So AI has obviously been growing a ton in the past year and a half. How much have you guys started trying to incorporate AI into your different analysis on the projects that you're on?
So we've been using things like, so for example, it's slightly different. We use quite a lot of machine learning techniques, but I think that's probably slightly different from AI. I think one of the things that we have found interesting with things like ChatGPT is how good it is at like sentiment analysis, for example. So for example, if you've got a whole bunch of comments on a TikTok video, or I don't know, something like that, like we've put it in and said, can you do a sentiment analysis? And it is like scarily good at, synthesizing that information. So we found that kind of synthesis of information is really, really good. And I've seen like people, coding up, basically like having code of analyses itself, doing like, some EDA, some exploratory data analysis, and producing like summary tables and producing like some statistical hypothesis testing. There are so many assumptions with these techniques that you need, is when you do statistical modeling, like each model has like a lot of assumptions that need to be checked. And I guess my main concern when it actually comes to doing the statistical analysis side of things, like the modeling that we do and the amount of checks that we do, I don't know how good it is at that side of things. Like how much can we trust those results?
Right. I guess I'm kind of curious as to, like, every project that you would go on, the assumption would be that the people that are bringing you in would be, they'd have a hit list of all the things that they want to look at and ask questions about. Yeah. But like the data that you're given probably contains way more patterns than what they're asking about. So at some point you kind of can let ChatGPT or something equivalent basically go off and you could just say, what maybe should we be asking? Like what things can you figure out that we haven't already been asking you about?
Unknown unknowns.
Yes, exactly.
Yeah,
and can you tell us, can you come up with questions that maybe we'd be interested in, but we're not asking?
Yeah, but then there's the issue of putting the data into the, like, do you see, like there's definitely ethical considerations as well, because this is like, quite often the data is commercially sensitive data. So there's also this issue of like, how do you do that in terms of keeping that data commercially sensitive, for example?
Check online.
I mean, I'm hoping it's not going to take me out of a job. I don't think so, not yet. Hopefully not.
That's great. Well, thank you very much indeed, Lynsey.